Welcome to Medical Spa Insider. I'm Kathy Christensen, President and CSO of AmSpa, and I'm happy to welcome you to this very special podcast featuring 4 leaders in the medical spa industry who are also featured speakers at the upcoming Medical Spa Show 2025. This week, we are so pleased to chat with Medical Spa Show speakers Kim Burke, APN, FNP-C, Kiss Aesthetics, Julie Bass Kaplan, FNP-BC, Cannes Disappearing Act Medical Aesthetics, Kiiyonna Jones, PhD, FNP-C, Lux Beauty and Wellness Boutique, Dr. Josie Tenore, Trevi Longevity and Aesthetics, and Audrey Neff, Patient Now. Before we kick things off, we would love to give you the chance to see these faculty members, as well as all of our other speakers and exhibitors while enjoying the parties, networking, and fun in Vegas at MSS. As a Medical Spa Insider podcast listener, we're offering you 10% off registration. Just use the code Medical Spa Insider MSS25, all caps, Medical Spa Insider MSS25, all caps, as a promo code when you register at www.medicalspashow.com.
Promo code expires on April 10, 2025 at 11:59 p.m. Pacific Standard Time. Promo code only applies to the primary registrant. Promo code cannot be applied towards additional attendee registration and cannot be combined with any additional offers. Discount only applicable to new MSS 25 registrants.
And now, without further ado, please welcome Kim Burke.
Hi, my name is Kim Burke, and I am the owner of Kiss Aesthetics in Chicago. We have 2 primary locations in the Southwest Burbs, and I'm really excited to be presenting yet again at AmSpa 2025 at the Wynn. As we know, it is April 11th through 13th, so it'll be really, really exciting. They always have great content, tons and tons to learn. One of the things that people generally ask is, what is something that you're really proud of that you've achieved since you've been in the med spa industry? I would say the biggest thing that I'm really proud of is building a team that I feel has a lot of autonomy and room to grow and a safe space to learn and embrace education and, just really being positive and picking each other up. When I first started, I was on my own. I basically was in a salon suite by myself, which, as we know, can be really, really challenging when you don't have colleagues or team members or support staff to kind of help you grow and market and answer the phones and book the appointments. And, I was doing all the things, but I was doing them all by myself. So it was a slow, steady build. And once I figured out the right people to have in the right place, it really just kind of excelled from there. So once again, being in a salon suite, single injector, one-man show, to now we have about a staff of 16 and we have 2 locations. And the staff that we have is very much they're my everything. I mean, I rely on them, and I know I can count on them. And it's really challenging trying to figure out, who's going to treat my clients the way I would want them to be treated, and releasing the reins and learning to delegate. That's very hard. I would say, when you ask about biggest failures, I like to honestly learn from my mistakes, and I don't have regrets. I have no regrets. When we talk about things as a group. It is not the end all be all and the buck stops with me. We collaborate and discuss what is the best way to approach, whether it's an issue or concern that somebody's having, or if something could move a little bit smoother, or how can we improve the client experience? What are some fun things that we can do with branding and marketing? It's a collaborative approach. So, multiple brains are better than just one. So I am always all ears. It is definitely not something that I attempt to pretend like I know all the answers, because I definitely do not. I do not know all the answers. And I'm not afraid to say that. So I think being humble, and I think being honest, and, really staying true to yourself and being comfortable saying no. So that actually brings me into one of the things that we will be discussing. I will be speaking on Sunday at AmSpa at the Wynn, which is a beautiful hotel, by the way. Good job at the hotel choice. And I will be talking about things that are controversial. So I'll be on a panel with other injectors, and we'll be discussing all of the things that potentially can be controversial, whether it's self-injecting, whether it's saying no, whether it's injecting people out of your comfort zone, having your clients push you. How do you handle, somebody in the chair where it's kind of a push-pull? What's the best way to handle this? So we're going to be talking about all the controversial things. So that should be really interesting. That's from 9 to 10:30 on Sunday. And then later, just a little bit later at 10:45 to 11:15, it's going to be a head-to-head. So it's going to be me and another injector. As of right now, I know it's Julie Kaplan, who we all know and love, is Jubilant Julie. And basically we are going to devise treatment plans based off of somebody who has a very limited budget, and my treatment plan versus other injectors' treatment plans. It's not that one is right or wrong. There's just multiple ways to get to the end result. And with that, we're going to be presenting the different cases and how we can achieve that result on such a limited budget. So it'll be super interesting to hear different takes on learning to inject somebody on, or full facial balancing on a budget, which is actually what I spoke about last year. So, one of the biggest things that I love to use is a combination of, biostimulators in addition to your HA fillers, along with tox, all of the things like layering and multimodality approach. That's how you're going to get the best results. Obviously, adding in your retail skincare and your chemical peels and your devices and things like that. So I'm really, really excited to have the opportunity. I'm very grateful that AmSpa has asked me to be a part of this amazing med spa show yet again, and I hope that you will all be there, and I hope that you all learn a lot. I always learn and take away, whether I'm doing a training or just talking to other peers or networking with others within the industry. It's really kind of a fun opportunity to talk to other injectors that may not be your competition. So if I'm, in Illinois and I talk to an injector out in, let's say, Maine, and we are just discussing the nitty-gritty. How do you best handle this? Or what do you do when your patient wants this? And you can really talk about, and speak freely about all the things that you would want to do or your treatment plans, and feel free to share and not feel intimidated or as if anything you're holding back or gatekeeping per se. So it's a really great opportunity to network, to learn, to grow. I really hope that I see you all on Sunday, and that is April 13th at the Wynn at AmSpa. See you then.
Hello, I'm Julie Kaplan, and I'm owner of Disappearing Act Aesthetic Medicine and also Jubilant Head and Breakfast, Ultrasound, and Anatomy Workshops. I am so excited to be speaking again this year at AmSpa's Medical Spa Show. I have been in the aesthetic field of medicine now for 25 years. What the heck? I can't even believe it. And I don't like to say the aesthetic industry because let me tell you, it is not an industry. The people who make and sell syringes, filler, or vials of neurotoxin, those are members of the industry. We are aesthetic medicine professionals. We are practitioners, doctors, nurses, nurse practitioners, PAs. We are not in the industry. So that's one of my pet peeves I'd really like to change over the years. But in the last 25 years, I have really found that some of the biggest failures I've experienced have really been in selling myself short, not having the confidence of myself and my skill set, and not thinking I had room at the table for somebody like me, a small town girl who was, quote, just a nurse. So I think that we have a lot to add. And nurses, by the way, and NPs, and PAs. We do over 90% of all the procedures in the entire world. So we deserve a seat at the table. And after 25 years, if I could go back and change just one thing, it would be to have more confidence and really get out there and do more. All right, I'm getting my workout in while I'm talking to you. And that's another thing, stay healthy, because we need to put a healthy face out there. And I'm getting close to 60 years old, and let me tell you, healthy is a big deal. But it's exhausting. Oh my God. I invite you to come check out my sessions at the Medical Spa Show 2025. My first panel is going to be taking place on Saturday, April 12th at 1:05 to 2:05 p.m. in the Strategic Leadership and Effective Management Practices track. And it's going to be called Perfect Partners. And I get to speak right alongside my practice manager, Rebecca McAbee. She is so amazing. And we are going to be talking a lot about things we did wrong, things we did right to build that perfect team and really be sure that everybody has the same morals, ethics, values, and really that culture that really melts with you. So I hope you find that really, really, really valuable. And next on Saturday on the clinical track, I'll be on the panel about the worst I've ever had, complications and how to overcome them. And I'm going to be with Jenny Hartley, ACNP, Skin Synthesis Clinic and Spa, Jenna Hilton with Healthy Balance, and Gilbert Senez III, an Austin plastic surgeon. On Sunday, April 13th from 9 to 10:30 a.m. in the Bridging the Divide Conversations on Controversial Issues track, I will be on the panel When It's Right to Say No, Self-Injecting, Challenging Patients, and the Injecting Outside of Your Comfort Zone panel. I think it's going to be really great, so I'm excited about that one. And finally, on Sunday from 11:15 to 11:45 a.m. in the What Would You Do, Clinician versus Clinician, I'll give you my hot take on the best way to treat a patient complaining of lower face laxity, seeking a snatched jawline, and will be, I hate this word, competing, because really competing with Sarah Cole, a fellow top injector in the field of medicine. So you get to vote for the favorite treatment option between you and the two of us. Can you believe they're going to make us compete? What is this, AmSpa? I love you anyway, and you know I do. Okay, guys, I'll see you at the Medical Spa Show 2025. Love you.
Hi, everyone. My name is Dr. Kiiyonna Jones, PhD prepared, certified nurse practitioner, and owner and founder of Luxe Beauty and Wellness Boutique, where I empower women to look and feel their best from the inside out. I am beyond thrilled to share that I'll be speaking at AmSpa's Medical Spa Show 2025. This event is the place to be for med spa owners and entrepreneurs looking to take their businesses to new heights. You may or may not have heard of this little thing called artificial intelligence. Well, my session is all about showing you how to transform your med spa from a one-person operation into a practice that feels like it's powered by a full team, giving you the tools to work smarter, not harder, and create an exceptional client experience without the overwhelm. I've been in the medical aesthetic industry for over 6 years, and over that time, I've learned that success isn't just about offering great treatments. It's about having the right systems, tools, and strategies to make your business work for you. That's where my secret weapon comes in, artificial intelligence. As a solopreneur myself, I know firsthand the challenges of wearing every hat in your business, from marketing to operations to guest relations and everything in between. But here's the game changer. AI can feel like the team you don't have. Over the years, I've become passionate about helping other med spa owners understand how to mobilize AI and automation to run smarter businesses, to save hours of time, and yes, to finally step out of the grind and into the freedom we all dream about. My proudest achievement is watching solopreneurs I've mentored scale their practices without sacrificing their sanity or personal lives. I'm here to show you how you can do it too by making AI your secret weapon. Now, don't get me wrong, my journey hasn't been without bumps. One of my biggest failures was managing too many roles in my practice, especially as a newbie, at the same time. And this failure taught me this. You can do it alone, but you don't have to. There are so many alternatives such as delegation, leveraging automation, and now we have the ability to leverage AI. AI has become the bridge between solopreneur overwhelm and streamlined success. Now, I want to invite you to join me at Medical Spa Show 2025 for my session, AI as your med spa team, how solopreneurs can maximize profits and reclaim time with AI systems and automation. So I want you to save this date. It's going to be Saturday, April 12th from 2:15 to 2:40 p.m. in the Marketing Mastery Strategies for Success track. This session isn't just another talk. It's your opportunity to see what's possible when you harness the power of AI. I'll show you how AI can act as a full med spa team. Think of it as a virtual assistant, a marketing guru, and an operations manager, all rolled into one. The exact tools and systems I use to automate repetitive tasks that I recommend for my mentees so they can focus on the best version of themselves, you can do it too. This is a proven framework to increase your profits while reclaiming your time. Imagine more time for yourself, your family, and your big picture goals. And here's why this matters. Whether you're just starting out or trying to scale, AI has the potential to revolutionize your practice. Solopreneurs, this is your moment to stop feeling stretched thin and to start building a business that works as hard as you do without needing a massive team or budget. So let's make it happen. The future of aesthetics, medical aesthetics, is here, and I can't wait to help you unlock its potential. If you've been wondering how to scale smarter, serve better, and finally take control of your time, this session is for you. Come with questions, leave with strategies. See you at the Medical Spa Show 2025.
My name is Dr. Josie Tenore. Most people call me Dr. Josie. Here. I started my career some 40 years ago, and I have been fortunate enough to get some of my medical training in Canada, some in New Zealand, and once I had a lot of medical training in my background, I actually got a master's degree at Harvard University in Massachusetts. After 25 or so years practicing primary care in the academic sphere, I left that to focus my career predominantly on aesthetics. Or so I thought. I founded Trevi Longevity and Aesthetics roughly around 2010. And around 2012, 2013, what I was starting to find was that people were not having the best health. As a result, it affected their aesthetic outcome. The byline to my practice has always been beauty begins with beautiful skin, but beautiful skin begins with a healthy body. So in around 2012, 2013, I added isoidentical hormone replacement therapy to my practice and medical weight loss. In 2013, I also founded Dr. Josie Recommends, which is a research and aesthetic company. Because what I noted was that when patients came to me not feeling great and wanting to have really good outcomes or wanting to feel better, that they were on, lots of supplement regimens, some of which were, questionable at best. I've got a great story. A friend of mine is a cyclist and was on a treatment protocol of supplements that he got from his local cycling shop. And he sort of commented that he just wasn't feeling quite as energetic as he could be. And after some coercing or gentle teaching, I got him to come into the office and we did, a whole profile on him. And rather than figure out that he had, vitamin toxicity, which is what I was thinking that was going on with him, we discovered that he actually had a lot of vitamin deficiencies. And as a result of that, we put him on a different protocol. But some of the supplements out there that I was trying to use were not really sufficient. So I started creating, because I'm a little bit of a mad scientist, some supplement regimens that actually have really done a great job addressing some cardiometabolic issues and improving them. So when I think about this and I think about some of my successes in my career, they really have to do with the fact that I like to take the individual in front of me. Rather than population health, I look at the individual health and I focus in on what that person needs and do appropriate testing and really listen to what outcomes they deserve, and then create protocols that are based in science rather than just on the lowly trends. So in the last 20 years of practicing aesthetics and longevity medicine, I've seen a lot of change. Everyone's seen it. Initially it was like, what's the latest fad in the magazine article? And now it's, what's the latest video on TikTok? And my strength has always been to look at the science behind these claims and really hone in to see, is there any validity? And if there is, adapting that to my practice. And if there isn't, pretty much discarding it and, next, move on. Another story is that, based on this, is that individuals, regardless of your treatment protocols and treatment outcomes, they are unique. And while one of my clinical successes has been to create a protocol to get people healing from full face resurfacing, including a laser blast, in less than 5 days, there are individuals that may not be as healthy, they may not have any hormones in their system, and that protocol, it has been phenomenal for me. But I did have a patient who was older and was, malnourished, I discovered, and it took several additional days and weeks to get her properly healed up. So, caution to that tale is everyone is unique, and we really do have to focus on the individual regardless of what we do. When it comes to treatment failures, I would say that because I'm such a mad scientist and I continue to add services to my treatment, to my service menu, my business has become very, very complex. So as a result of that, there's a couple of issues that happen because of the complexity. Number one, patients during, a Botox treatment will often start asking me about their hormones or their supplements. And I find myself giving away a lot of my medical expertise for free, which is a problem. And it makes the visit very complicated because, my head's in the aesthetic space and my patients want me to talk in the wellness space, and it becomes even complicated for me. The other thing is when it comes to staff training, while I attract great staff, when it comes to training them on the whole scope of all of the services I have to offer, it is challenging for me to appropriately train staff in the onboarding process. But regardless, I do think that the opportunity for having more services is great, and adding IV services, which is what I will be speaking about at the conference, is a great addition to the aesthetic space. So what I'll be talking about at AmSpa at the conference is IV therapy in the aesthetic practice. And in that, I'm going to cover, what protocols are appropriate, how to customize treatments, what do you need to provide these services safely, and also sort of some of the financial metrics. So I hope to see you in Las Vegas in April. Bye for now.
Everyone, Audrey Neff, Senior Director of Marketing Strategy for Patient Now, and I am so excited, honored, ecstatic to be speaking at the 2025 Medical Spa Show put on by the one and only AmSpa. So I have been in this industry for 10 years, which is crazy to think that I have been in the medical aesthetics industry for a decade now. It's certainly been an incredible decade of my professional life. And if I were to think back of what were some of the biggest lessons I've learned in my 10 years in this industry, I would say as it relates to unlocking new levels of success in your professional and business life, I would certainly say that we need to be very comfortable with being uncomfortable, right? So imposter syndrome is certainly something that we talk about a lot, but it is something that we actually need to apply to ourselves as it relates to building a thriving practice. So we need to start before we're ready. We need to definitely put ourselves in uncomfortable situations if we want to, build a thriving and sustainable medical spa in 2025 and beyond. As it relates to what my biggest business success would be, I would say it's certainly been just helping practices achieve maximum success in their business. That's certainly what fuels my fire at the end of the day, whether it's related to marketing, retention, membership programs, you name it. That is just what I really love to do more than anything in the entire world. And so with that said, I am super excited to be teaching a course all around building high-value membership or loyalty programs in your practice. I will be teaching on Saturday in the marketing session at 4:25 p.m. And we will be taking a deep dive into the benefits of implementing a membership program, the direct correlation that retention has on your practice. And then we will be going through the core 5 different types of programs that you can build with real life examples as well, that any of you can certainly take away home as a template to use to build your program. In addition to that, we will also be covering sales strategies, right? So how do you actually create adoption with membership programs? So not only does your team and your staff members and your providers need to be 150% bought into your membership or loyalty programs in the practice, but your patients actually need to be completely bought in as well. So we'll talk about how do you effectively sell memberships? How do you use them in conjunction with building customized, comprehensive, long-term treatment plans? Believe it or not, membership programs are actually very, very powerful at increasing patient adoption and conversion with treatment plan buy-in. So we'll be covering a lot of ground. In the talk, we'll also actually be going through some financial case studies as well as clients, medical spa clients I've worked with over the years, and it will be a ton of information and we'll also have a lot of fun. So I certainly encourage everyone to attend the one and only Med Spa Show. It's one of my favorite aesthetic conferences of the year, and I hope to see all of you in 2025 in Las Vegas.
Don't miss Medical Spa Show 2025, April 10th through the 13th at the beautiful Wynn in Vegas. Use code Medical Spa Insider MSS 25, all caps, as a promo code when you register at www.medicalspashow.com. See you there.
Promo code expires on April 10, 2025 at 11:59 p.m. Pacific Standard Time. Promo code only applies to the primary registrant. Promo code cannot be applied towards additional attendee registration and cannot be combined with any additional offers. Discount only applicable to new MSS 25 registrants.